Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about nerve biopsies, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the second subsection of the third section, specialist tissues, called nerve biopsies. The portfolio offers indicative repertoire for this section that includes hematoxylin and eosin, Luxil fast blue, Gomery trichrome, glial fibers, myelin, neurofibrillary tangles, senile plaques, Nissl substance. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is principles of nerve biopsy sampling. What is the principle of nerve biopsy sampling? Candidate needs to have the knowledge and understanding about principles of nerve biopsies. You could ask the candidate to explain how and why are nerve samples obtained and sent to histology, to list anatomical site where biopsies can be taken, to explain surgical techniques used during nerve biopsy sampling, to explain how nerve samples are handled. When addressing this knowledge requirement, candidates should consider optimal specimen site and selection, surgical method used like open technique, sample handling like rapid preservation via snap freezing or fixation, multifaceted analysis via various stains, tissue evaluation. The second knowledge requirement is principles and practice of direct visualization, routine staining, and histochemical and impregnation methods for nerve tissue. Candidate needs to have the knowledge and understanding about demonstration methods used for nerve biopsies. You could ask the candidate to list methods to detect relevant nerve elements, to explain the principles and practice of those methods, to name diseases that can be detected by those methods. When addressing this knowledge requirement, candidate could consider sample transport, handling, method used like freezing, fixation, EM processing, orientation of sample, cryotomy, microtomy or ultramicrotomy, staining techniques used, interpretation of stained sample, purpose of each staining method used, storage of sample following analysis. For staining methods, candidates should consider the indicative repertoire and stains used in your lab. The third knowledge requirement is principles and practice of handling fresh, frozen and fixed nerve samples. Candidate needs to have the knowledge and understanding about handling fresh, frozen and fixed nerve samples. You could ask the candidate to explain how they would handle fresh, frozen and fixed nerve sample, to explain the difference between them, to name risks associated with various handling methods. When addressing this knowledge requirement, candidates should consider their primary use and the procedures, proper sample handling, careful approach to minimize mechanical damage, time sensitivity of samples, need for orientation, freezing, fixation, processing, cryotomy, microtomy, ultramicrotomy, staining techniques used, interpretation of findings, purpose of each method and storage of samples following histological analysis. The fourth knowledge requirement is ancillary methods used with nerve samples. Candidate needs to have the knowledge and understanding about ancillary methods for nerve samples. You could ask the candidate to name ancillary methods used for nerve biopsies, to explain why they are performed, to list what those methods highlight in nerve tissue, to highlight their application and clinical value. When addressing this knowledge requirement, candidates should consider special stains, enzyme histochemistry, IHC, if staining, EM analysis, molecular or genetic testing, teased fiber preparation and morphometry, the interpretation of those methods, their targets, application of those methods, and their clinical value. The fifth knowledge requirement is risks and hazards associated with nerve samples. Candidate needs to have the knowledge and understanding about risks and hazards of nerve biopsies. You could ask the candidate to name the risks and hazards associated with nerve samples, to explain how they would minimize them. When addressing this knowledge requirement, candidates consider various risks to patients during the procedure, risks to the lab staff like infectious risks and exposure routes, technical hazards associated with sample processing during freezing or fixation, chemical hazards associated with reagents used during processing and staining, risks associated with reagent and sample storage and disposal, mitigation strategies like COSH, use of PPE, ventilation, SOPs, waste segregation, risk assessments, safety data sheets. The sixth knowledge requirement is diagnostic relevance of nerve biopsy. Candidate needs to have the knowledge and understanding about diagnostic value of nerve biopsies. You could ask the candidate to explain, what is the diagnostic relevance of nerve biopsies, to explain the diagnostic value of nerve biopsies, to name diseases that can be investigated on nerve biopsies. When addressing this knowledge requirement, candidates should consider the diagnostic relevance for disease diagnosis, therapeutic impact, fiber evaluation and pathological deposits identification, diseases that can be detected on nerve biopsy like inflammation, demyelination, amyloidosis, lymphomatosis, neurosarcoidosis, various neuropathies, storage disorders or axon degeneration. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is discuss the application of nerve biopsy demonstration techniques. Candidates should be able to discuss application of demonstration methods for nerve biopsies. Does the candidate perform demonstration methods for nerve biopsies? Can they list all methods they perform on nerve biopsies? Do they know the application of those methods? Do they know what diseases they detect? When addressing this competence requirement, candidate could consider demonstration techniques in indicative repertoire and techniques used in your lab, their application, and diseases they detect like inflammation, amyloidosis, neuropathies or degenerative diseases. The second competence requirement is select and use correct visualization, staining, histochemical or impregnation methods to identify elements within nerve biopsies. Candidates should be able to select and use correct demonstration methods to identify nerve elements. Can the candidate select and use correct demonstration methods for nerve elements? Do they follow the local SOPs? Can they identify the nerve elements demonstrated? Can they interpret the stained slides? When addressing this competence requirement, candidate could consider SOPs, method used, elements identified like inclusions, axons, or myelin sheath, quality control, use of control material, training, competency. The third competence requirement is select and use control material, maintaining audit trail. Candidates should be able to select and use correct control material for demonstration methods. Does the candidate use correct control material for relevant demonstration method? Do they maintain correct audit trail for control material use? Do they produce appropriate control material for each demonstration method? When addressing this competence requirement, candidate could consider tissue types, verification, validation process, record keeping, traceability, audit trail, importance of selecting correct control material, consequences of not using correct controls. The fourth competence requirement is use microscopy techniques to visualize methods, as appropriate. Candidates should be able to microscopically assess stained slides. Does the candidate use appropriate visualization techniques to assess stained slides? Do they use light microscopy, immunofluorescence, and electron microscopy during the slide assessment? Do they set up microscope correctly? When addressing this competence requirement, candidate could consider light microscopy, immunofluorescence, electron microscopy, magnification, Kohler's illumination, digital image capture, AI algorithms. The fifth competence requirement is identify stained elements within nerve biopsies. Candidates should be able to identify elements demonstrated in nerve biopsies. Does the candidate identify stained elements within nerve biopsy correctly? Do they correctly interpret stained slides? When addressing this competence requirement, candidate could consider microscopic examination of stained slides, demonstration method used and the target element or nerve structures they highlight like fibers, axons, or Schwann cells, their training and competence. The sixth competence requirement is assess stained sections for quality. Candidate should be able to assess quality of stained sections. Does the candidate assess stained section for quality correctly? Do they take correct steps during the assessment? Do they focus on correct features when assessing quality of staining? Maintain appropriate audit trail? When addressing this competence requirement, candidate could consider staining intensity and uniformity, specificity and sensitivity, presence of background, consistency of staining, presence of nonspecific staining, staining intensity, EQA assessment criteria, relevant documentation, control material. The seventh competence requirement is resolve any associated problems with the staining or histochemical methods, including root cause analysis, as appropriate. Candidate should be able to troubleshoot staining. Does the candidate resolve problems with staining correctly? Can they identify and solve the common problems? Record problems and resolutions accurately? Can they perform root cause analysis? When addressing this competence requirement, candidate could consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring, possible problems like poor staining intensity, poor specificity of staining, artifacts like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, effects of fixation, processing and antigen retrieval on quality of IHC staining, nonspecific staining, background, absent staining, cross-reactivity. The eighth competence requirement is dispose of waste reagents and residual material safely. Candidate should be able to safely dispose waste reagents. Does the candidate dispose staining reagents safely? Do they follow local procedures and avoid risks associated with staining reagents? Do they segregate waste as per regulations? When addressing this competence requirement, candidate could consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. You could ask them to identify relevant aspects of nerve biopsies from digital images of your in-house demonstration methods. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidates' specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.